I'm Denise Williams. I am the Manager of Therapeutic Services at Genesis Behavioral Health, and I have worked in the field of behavioral health and addiction for over 35 years. People that seek treatment and begin recovery, their rate of recovery is the same as a person who has heart disease or diabetes and also seeks treatment and begins lifestyle changes. But if you look at how many times a person that has heart disease or high blood pressure, how many times they relapse and get back into it again, it's the same as it is with addiction. When an alcoholic or an addict relapses, we feel discouraged and frustrated because we think that's a bad thing or it's very negative, but actually it gives that person the opportunity to get back into treatment and to learn something else that will help them stay sober. I look at returning to treatment as gaining another piece of the puzzle, and that piece of the puzzle will give them another piece of what they need to build a lifestyle of sobriety. If you suspect that you or a loved one is experiencing a medical emergency, and that may be an overdose or it may be active withdrawal, the first step would be to contact 911 or to get that person to the nearest emergency department. For some alcoholics and addicts, a medical emergency is not what prompts them to seek treatment. It may be that they're suffering lifestyle consequences, either legal or family issues, and they decide that they need to get help. And so the best direction from there would be to contact an outpatient agency and get an assessment. There are a lot of different kinds of treatment programs. Genesis Drug and Alcohol Recovery Program has an intensive outpatient program where our clients come 2 to 3 days a week for about 3 hours at a time, and they're in group therapy and individual sessions. We also have family programs. And so that way the patient can get a lot of education and group therapy, and it's a way of slowly beginning to change their lifestyle, helping them to learn about addiction, helping them to learn about coping with stress and coping with life without using the drink or the drug. And then if intensive outpatient isn't an option, or if that's not the best treatment program for them, then we can look at other facilities, because we do have residential programs. There's sober living in the community, and we also have medication-assisted treatment in the community. If you're a family member of someone who is struggling with addiction, there are services available for you. 12-step programs such as Al-Anon are very helpful to the family, and those are free and available to the community. There are also other support groups in the area, such as Family and Friends, which is a support group for people that have someone who's struggling with addiction. And also just private counseling, that's available too, to speak with someone professionally. You might also seek counseling through your church or any other EAP service that your employer offers, but there are a lot of options in the community for the family member to get help as well. And you can also contact any treatment program, and they can give you guidance and direction and even counseling if you would like to talk with them. Many people don't seek help for addiction because of financial concerns, but in reality, it doesn't matter what source of income that you have. There is some way of paying for treatment. There's self-pay, there is Medicaid, there's insurance. Commercial insurance does pay for a portion of drug and alcohol treatment. And we don't deny a person services because they don't have insurance or they don't have the ability to pay. So money should not be an issue or should not prohibit someone from seeking help for drug and alcohol addiction. I think that recovery is possible. People do get sober and stay sober, and I see people on the street that I've had as clients, and they'll come to me and say, hey, I've been sober 5, 10, 15 years, and that's very rewarding. to see that people have recovered. And there are people in recovery that you just don't know they're in recovery because they don't talk about it. But because once a person's been clean and sober, they start to blend in with life. They're working, they're raising their children, they're doing what everybody else is doing. And you don't know that they're in recovery unless they happen to share that with you. So they don't look like alcoholics or addicts once they've been clean and sober for a while. But recovery is possible. It does happen, and I think it's just a struggle, and it's just keep at it. Keep trying, and if you keep trying, you will be successful.